Greetings. Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center, reporting for the week of July 19th, 2021. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. Now, we know that even though the pandemic is worldwide, the effects are different depending on where you are, so we're here to give you up-to-date information about Alameda County, Oakland, and East Oakland in particular. Alameda County has 92,580 recorded COVID cases and 1,271 COVID deaths. Vaccination has barely budged since I reported on this last week. We are at 82.9% of those 12 and up with at least one dose, and 70.4% of those 12 and up fully vaccinated. Oakland is lagging just a little bit behind at 81% with one dose and 67% being fully vaccinated. And when we look across the county, we can see that there are pockets that are much less vaccinated than others, and so you can see that the lightest areas here are the least vaccinated, and this is the census tract map, which is available on the county's website. When you go there, you can actually put in your address so that you can see where your area ranks in terms of vaccination rates. And of course, we are concerned with low vaccination rates that the spread and outbreaks can still occur. We are seeing case positivity rates as well as overall case rates heading up pretty sharply in the wrong direction here, and this is some of it is expected after the opening and the relaxation of restrictions on June 15th, but this is a concerningly steep rise here, particularly given the level of vaccinated people that we have. So what this means is that the virus is still finding susceptible hosts. We know that the vast majority of people who are contracting COVID are unvaccinated, and there are still plenty of people out here who are unvaccinated who are susceptible and able to contract COVID-19, and that is by and large what we are seeing here, and even more so when we look at hospitalizations. Now, you can see that we had a little bit of a low point there on June 8th prior to the reopening, where we had just 20 people in the hospital and with COVID-19, and in just 6 weeks here we see that it is more than quadruple, and now we have 88 people with COVID-19 in the hospital. And so we are seeing that folks are still getting sick enough to be hospitalized, and this is obviously a big concern. We expected an increase in cases after the relaxation of restrictions, but I think we were certainly hopeful that the most vulnerable would be protected with vaccination by now. But what this indicates here is that we still have vulnerable people who are contracting COVID-19 and getting sick enough to go to the hospital. Deaths usually trail behind by another several weeks. As we know, COVID hospitalizations tend to be prolonged, and so we will be keeping an eye to see if our deaths increase as well, but right now this is certainly of concern. And as we've seen nationwide, about 97% of those who are landing in the hospital are unvaccinated, and about 99% of those who die are unvaccinated. So at this time, our greatest concern really is for those who remain unvaccinated. Now, as a reminder, there are four main factors that are driving increased spread. The first is an already very contagious virus, which is mutating to become even more contagious. Also, our reduced public health measures and increased mixing. And last but definitely not least, our uneven vaccine distribution. And so in light of this current situation of increasing cases, our 7 Bay Area county health officers got together, as they have many times through this crisis, to offer recommendations and orders and protections for the residents of the Bay Area counties. And on July 16th, they put out this press release which is referring to this increase in cases. It is referring to the increase in the more contagious Delta variant, which I'll talk more about in a moment. And it recommends that everyone, whether vaccinated or not, wear a mask while indoors. And this, as they say, is out of an abundance of caution. And this is primarily because we want to protect those who remain unvaccinated. And this includes, of course, everyone 11 and under. It also includes that very small percentage of people who may not be able to get the vaccine due to uh, being on particular medication or having severe allergies to one of the specific ingredients in the vaccine. Again, this is a very small percentage of people, but also there are some people who may have immune conditions or be very elder who may not have mounted a great response to the vaccine. So all of these people remain very vulnerable to COVID-19. And at this point, masking is being recommended because after vaccination, wearing a mask is the next thing that helps to prevent the spread. And as we know, we are currently dealing with a more contagious type of COVID. So it's actually the case that we have to be even more concerned and even more vigilant than we were initially if you are unvaccinated. And at this point, what the Bay Area County officers are asking is that those who are vaccinated, although we are protected from hospitalization and death, that it is really an ask that those who are vaccinated continue to protect those who are not. And so this is a big ask. Not everyone loves this ask, but at this point in time, there are whole swaths of the population that really don't have a choice, especially our 11 and under people. And so continuing to wear the mask for longer is the most prudent thing to do in order to mitigate the spread. And so you can see here, and I took this from the state website, this is showing the breakdown of the variants in California. And as you can see here, the Delta variant, which was not making up any of our cases as far as we know in February and March, by April was 2%, by May was 6%, and by June almost half. So this thing is taking over quite quickly. And why is this of concern? Well, as you can see here, and I borrowed this from the Imperial College Lancet Australian government, this is showing the contagiousness of COVID-19 and the various strains. And so that first one there, we didn't really experience this much here in the United States. The one in the top left, that was the original virus in Wuhan. By the time it really took hold here in the United States, we were dealing with the one on the top right there. And what this is saying is that one person, the person in blue there, could infect an average of 3 people if there's no masking or distancing or vaccination. So basically, without any measures in place, that is how contagious this virus was, the original one that we were dealing with about a year ago here in the United States. For the main strain that we were dealing with, Alpha variant, or otherwise known as the UK, was more contagious. But of greatest concern, the one we're dealing with now, the Delta variety, is looking like one person can give it to 5 to 8 people. Now, again, this would be an unvaccinated population where we're not doing masking and distancing. But this is very, very concerning. And I think it's simplest to just think that the Delta is at least twice as contagious as the main COVID strain that we've been dealing with most of this time. And that is very, very concerning because that means that, let's say you have an unvaccinated household, an unvaccinated school, an unvaccinated workplace or community, that COVID is going to rip through and it is going to infect unvaccinated people at double the speed, double the rate as the one we were dealing with before. So this is highly contagious and highly concerning of a situation that we're dealing with at this point. So this is where we're at, and as long as there are susceptible hosts, meaning unvaccinated people, we will continue to be in this race, this very tiring, long race that we are in with COVID, and that COVID appears to continue winning. So now I am going to talk a little bit about the common objections that we are still hearing to the vaccine, because as we've said here, and as I've said here many times before, unfortunately, the vaccine is our only way out of this pandemic. I wish there were another way, but I think that all thinking people who are paying any attention can see nothing else we're doing alone is working. The only thing that has made a dent is the vaccine. But it's not going to be enough if we don't get the vaccination rates up, and we will continue to be in a race. We will continue to deal with more mutations as this virus continues to travel around like wildfire through unvaccinated hosts. The second thing that I said last week is that many people believe, and I'm in agreement with this, that at this point in time, given all the factors I just reviewed, you will either get the vaccine or you will get COVID. And so when you look at the data and you look at any of the minimal risks that we've seen with this vaccine that's now been administered for over a year now, we have over a year of data that is very long term in vaccine terms, because with vaccines we know that most of the adverse reactions and impacts happen within the first 6 weeks. So when you compare that math to the math of what you're dealing with COVID-19, then it's very clear. And so we want to really understand what it is that is making folks want to wait, and we want to be able to address those doubts, fears, questions, and concerns. And also challenge a little bit of the thought processes, because like I said, if you put the data out on the table and you look at it, there's only one way this math works out. So if you're coming up to a conclusion that you shouldn't get the vaccine, most of the time the math is just off. And so we need to talk through what it is that's getting folks to arrive at the conclusion that they are arriving at. I am not going to be able to go through all of the different objections, but I'm going to go through a few, and particularly the ones that we're hearing the most frequently. And the one that I've been hearing the most frequently lately is, well, I made it all this time and haven't gotten COVID, so I think I'm okay. And this one concerns me because as I've talked this through with folks, there is sort of this imaginary idea that since you didn't get it yet, that you must somehow be protected. You must already have some kind of antibodies. You must be that, you must just be that much stronger than all the hundreds of thousands of Americans who've lost their lives with this. And that's just a fallacy. Sorry, but this is called novel coronavirus for a reason. It's because our bodies have not seen it before. So if you haven't gotten the vaccine and you haven't contracted COVID, then you don't have antibodies. And so what you're doing is you're continuing to play Russian roulette. So when people tell me, well, I haven't gotten it yet, to me, what I'm hearing, what that sounds like to me is, well, I've been playing Russian roulette multiple times and I still haven't died yet. I still haven't got the bullet yet. And, if we want to use the Russian roulette analogy, then now that we've got a more, transmissible strain, it's like you've got bullets in more chambers at this point in time. And so you're just going to continue to play Russian roulette with COVID-19 and keep hoping that you won't get it. So this is pretty flawed logic, and I would like for folks who are using this logic to reconsider. The fact that you've not gotten COVID-19 yet is great. Maybe you have not gotten any COVID droplets on your mucous membranes, or you have not breathed in any COVID aerosol. Completely possible at this point in time. But it's only a matter of time because of the way it is still continuing to spread at an increasing rate. And because now there are many people who are vaccinated, they're not an attractive host for this virus. The virus can't take hold. People who are vaccinated are 85, 90, 95% protected. So the virus just keep moving on until it finds you. So it hasn't found you yet. That's good. I'm glad. But please don't lull yourself into some kind of false sense of security that means you're superhuman or that you cannot get COVID. That is simply not the case. Please reconsider and redo the calculation. You've been lucky so far. Count those blessings. but use your intelligence, use the tools you have, and make a decision that is based in logic. The second one that I've been hearing is, and this is especially for those who might get their information from Instagram, TikTok, Facebook, and what I hear and what I sincerely believe that they believe is, well, some doctors think the vaccine's a good idea and some don't, so I'm just going to go with the ones who don't. This really couldn't be further from the truth. I mean, this is one of those times where there's like no disagreement in the medical community, and this doesn't happen all the time. We disagree about stuff all the time. But this is one of those situations where doctors agree, scientists agree, vaccinologists, epidemiologists, public health professionals, we all agree. There is no disagreement in the field. Now, I've seen plenty of people wearing a white coat and have something behind them that looks like a diploma. Sometimes they don't say who they are. So you need to wonder about that. Who are you? What are your credentials? Is this even your area of study? You'll have some people that will say doctor. Now remember, there's all kinds of doctors, and they may well be professions in other fields. They may have their PhD in English literature. That's great, but it doesn't make them qualified to pretend as if they have any expertise, and certainly should not allow we should not allow them to cast any doubt upon an area that is not their area of expertise. I have seen some, and I've even sat down with some of the folks that have told me, well, I've seen these doctors. They sound credible. They look credible. And we have went ahead and taken a look. Who are they? And every single state has a medical board and a nursing board where you can look them up. So all you have to do is type in, for example, California medical license lookup, or California RN or nurse lookup, or any state. And you can look up that person and see if they are in fact a licensed and credentialed person like they say they are. Now, if they're lying about who they are and about who what their credentials are, well, what else are they lying about? People have a number of reasons why they're spreading disinformation and misinformation. Many of them are monetizing your mistrust. They are becoming popular. They are making money. Some of them are selling things. And so you really just need to be, please, very critical about who these people are and vetting their credentials. Sometimes you'll find that a person maybe they were a physician, but they've had their license revoked. And I'm here to tell you that you got to go pretty left in order to get your license revoked. So take a look, because I actually looked into a couple of these folks that are up here calling themselves MDs, and their stuff has been revoked for a decade or so. So I don't know what they've been doing in the meantime. But I would be seriously asking those questions of why did your license get revoked, and what is your motivation around spreading disinformation? So I think those are the two I'm going to get to today. I will continue to go through this because we are collecting the objections and the reasons why people are still concerned about the vaccine. Maybe I'll leave you with one more, which is I just want to wait a little longer. I know I've talked about this one before, but I really, really urge you. What are you waiting for? Please just come up with something and hold yourself accountable to what that is. Do you need to see your friends and family get it? Great. I'm sure that that's already happened. So do you need to see 100 million people get the vaccine? Well, that already happened a long time ago. So what is it that you are waiting to see happen? And please let me know what that is. admin@rootsclinic.org. What is it that you're waiting for? We really want to know and understand, because unfortunately what I'm hearing from colleagues that work in hospitals is that some people who are lying on those hospital beds and daggone near on their deathbeds are saying, I wish I would not have waited. I wish I would not have waited this long. And I don't want that to be you. I don't want that to be anyone else. COVID death is now a vaccine preventable situation. So just like I don't want anybody to die of tetanus or measles, I don't want anybody more to die from COVID-19. It just isn't necessary. We have the vaccine. We have the tool. So please, in the meantime, If you get symptoms, get tested. If you get exposed, get tested within 4 to 8 days. And please continue to have good nutrition, your exercise, get a good night's sleep, take your multivitamin supplement, additional vitamin D supplementation. And thank you for joining us. We'll see you again next Tuesday at 10 a.m.